Hi, it's Jetty from MedEd, your CNA instructor. So the next procedure I'd like to go over with you is oral care for an unconscious resident. So when you're doing oral care for unconscious, think about residents that are maybe in a coma or have a closed head injury. They're unable to respond to you. They're unable to swallow. So we have to be in lateral position. This way, any fluids that you put in the mouth are going to drain out the side of their cheek and not go down their throat. So we start by getting a report from the nurse. I've talked to my nurse. My resident's name is Annie. She's unconscious and she needs oral care. I've knocked on the door. I've introduced myself by name and title. I've called her by the name she prefers, even if she cannot respond. And I've absolutely explained everything I'm doing, because a lot of times when they're unconscious, even though they cannot respond to you, they can still hear you. You're going to find and gather your supplies. Oral care unconscious is done with just swabs. Some places call them touthettes. So it just depends on what your facility uses. But it's just a little sponge on a stick, because we do not want lots of fluids in the mouth. I'm going to close the curtain, drapes, and doors. I'm going to wear gloves as needed, washing my hands before I start, gathered up my supplies, using good body mechanics. So my resident's in lateral position. I'm going to protect the pillow and the bedding. So I'll place a towel over the chest, and then I'll place a towel over the pillow. I've got my 2 cups. 1 cup is going to be mouthwash, diluted half with water. That's going to be my cleaning solution. And then the other cup is just water. That's going to be my rinsing solution. I've got my swabs. Now, how many swabs you need is going to depend on how much mucus is in your resident's mouth. Sometimes we go through a whole package. So when you're doing this in your clinical setting, just wipe until it comes clean. Got my chapstick. Place the emesis basin under their chin. Put on your gloves. So the motions that you make really doesn't make a huge difference for your skills portion, but I'm just going to kind of demonstrate how I was taught in nursing school, and we're just going to kind of work from cleanest to dirtiest, wiping all the surfaces with the swabs. So I'm going to start with the mouthwash solution. I'm going to go inside the mouth, and I'm going to wipe the cheek, teeth, and gums in a C motion on this side. So just wipe the cheek, teeth, and gums. Get rid of that swab. Get a new one. We're going to rinse the roof of the mouth, front and back of the top teeth. Get rid of that one. Get a new one. We're going to wipe the tongue and the bottom teeth. Get rid of that one. Get a new one. And then we're going to go inside the mouth and do a C motion on this cheek, teeth, and gums. You're going to repeat the steps with water to rinse the solution out. So inside the mouth, cheek, teeth, and gums on that side. New one, roof of the mouth, top teeth. New one, tongue, bottom teeth. And a new one, cheek, teeth, and gums on that side. Your residents that are unconscious need lip moisturizer to keep their lips from cracking. While I was doing the procedure, I was checking TM, TL, teeth, mouth, tongue, and lips. For big dog scare, lots of children. B, bleeding. D, discoloration. S, sores. O for odor. L for loose teeth. And then C for cracks and chips. If you find anything unusual, make sure you report it to your nurse. Remove the towels. Place them at the foot of your bed. Take off your gloves. Wash your hands, and then do your final steps. A, check alignment, make sure they're comfortable. B, make sure the bed's in the lowest position, side rails is appropriate. C, make sure they have the call light and water if the doctor orders it. But even if they are unconscious, that call light still needs to be within a reasonable reach of the resident. D, ask them if they need anything else. E, say thank you, even if they can't respond to you. Make sure you thank them. F and G, find and gather your supplies, clean them to company or facility policy. H, if they're able, ask them how they want their curtains, open or closed. And then eye your way out. I'm going to wash my hands, I'm going to do a visual safety check of the room and environment, report unusual findings to my nurse, and document my procedures. Thanks for watching.